Every person lying in an intensive care unit is at a high risk of dying. He didn't want us to use his name, but this man in his 40s fought a near-death battle with COVID-19.
It happens that I took this patient. I was bedside care at the time that he came.
ICU nurse Martha Trapecio says incoming patients are younger than before. And the scariest lesson she's learned is how quickly COVID patients can deteriorate.
Suddenly they get worse and we can't revert that. They have to be intubated and go into a lot of treatments. And it's very fast.
I recall just waking up in an ICU ward and wondering where I was.
Dan Papalazaro caught the virus from his wife, a healthcare worker. The 57-year-old went to hospital with a fever and ended up on a ventilator for 22 days.
So many people may feel that they're immune to this virus, but you never know.
In the absence of a strategy for controlling this virus, some doctors are now publicly pleading with Canadians.
Today I saw a man who was fighting for his life, who was probably going to die from COVID-19. And it breaks my heart that we knew that this day was coming, and we didn't do enough.
And unlike the first wave, hospital beds across this country are no longer empty. Elective surgeries are back on.
There are only so many nurses, there are only so many physicians, there's only so much redeployment we can do.
Experts also point out, compared to other countries, Canada has fewer hospital beds. Japan tops the list with nearly 8 beds per 1,000 people. Canada has fewer than France, Italy, and the United States, with just 2 for every 1,000.
There's no doubt that we are very worried that this will not be sustainable in the weeks to come.
Healthcare workers have been working non-stop.
The population has to help us.
They're already doing everything they can to save lives. Christine Burak, CBC News, Toronto.